Welcome to Taking Healthcare by Storm Industry Insights, the podcast that delves into the captivating intersection of innovation, science, compassion, and care. In each episode, Quality Insights Medical Director Dr. Jean Storm will have the privilege of engaging with leading experts across diverse fields, including dietitians, pharmacists, and brave patients navigating their own healthcare journeys. Our mission is to bring you the best healthcare insights, drawing from the expertise of professionals across West Virginia, Pennsylvania, and the nation. Subscribe now, and together we can take healthcare by storm.
Hi, everyone. Welcome to another episode of Taking Healthcare by Storm. I am Dr. Jean Storm, the medical director here at Quality Insights. And today we're taking a closer look at one of the most frustrating challenges in healthcare today, patient flow. Why emergency departments are overcrowded, why hospital beds seem unavailable, and why patients often wait far longer than anyone would like. My guest today is John D'Alessandro, a healthcare operations expert who has spent more than 2 decades helping hospital leaders improve how care actually moves through their systems. Before entering healthcare, John worked in the automotive industry with companies like General Motors and Ford Motor Company, where he learned lean manufacturing and just-in-time supply chain principles that now shape his work in hospital operations. He has worked with major health systems, including Cleveland Clinic, HCA Healthcare, and Houston Methodist, to help reduce patient boarding, shorten lengths of stay, and improve hospital capacity, often seeing measurable improvements in days instead of months. John believes that by fixing flow, not by adding more staff or building more space, hospitals can dramatically improve both patient care and operational efficiency, 2 very important things. John, thank you so very much for joining me today.
Thank you for a great introduction.
Yeah. So, as I said, you began your career in the automotive industry, working with lean manufacturing and just-in-time supply chains. And I mentioned at General Motors and others. How did your experience ultimately lead you into healthcare operations and hospital flow improvement?
Well, the hospitals have been struggling with this problem since I graduated from college. In fact, my best man is an ER doc. And when we were sitting around talking about what's really going on at the hospital, I visited him one day. And it is a just-in-time logistics system, but it's not a factory. And so the attempts to sort of use Lean and Six Sigma, these are very mature technologies, but they needed an adoption. They needed something could control the human machinery and all the context, all the stuff that is more situational rather than systemic in how patients move through the system. So they're not broken because the people don't care, and the processes aren't that much different than they were 40 years ago. The issue is that we've taken something with a manufacturing metaphor and tried to force it into something it's not. And that's what the problem. We're trying to mechanize the flow, and it's not going to work. Humans are involved. Situations are involved. Full moon's out. So the ER is packed. Right? I mean, all the wives' tales you want to use. But the bottom line is, these things are human logistic systems.
Yeah, and I love that, and I love that you were able to see that. And I will say, where I worked in healthcare, yeah, people think it is the full moon, right?
Right.
So you've spoken about facing a serious personal diagnosis that changed your perspective on healthcare. So how did this experience change your mission to help hospitals operate more efficiently and treat patients better?
I was diagnosed with a form of muscular dystrophy, and I bounced around the healthcare their system for, no joke, 3 years. Biopsy, all this stuff. Why did it take 3 years? Because the biopsy took about an hour. It took 3 years because it takes 6 months to get the first appointment, and then so many more months to get the follow up. And then when you hear that it needs it's just breathing 24 hours a day, you get a medical or a durable medical equipment company that didn't get the facts from the doctor's office. So they can't bring the equipment till the doctor's office sends the facts. Blah, 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 blah. These delays. Care actually is ration care. We don't even have a true demand signal because people can't even get in to get it. This stopped being an interesting problem. It turned into a mission. If you could have a baby, I got great insurance. Having a baby, having anybody.
Yeah, definitely. And I've heard many stories like that. And I mentioned in the intro that emergency department wait times are one of the biggest frustration. I've seen people on Facebook often posting, been in the ER 8 hours, 10 hours, 12 hours. And it's an uncomfortable place to be. I know. So it's a big challenge for health systems. Yeah. So from your perspective, working with hospital systems like Cleveland Clinic, HCA Healthcare, Houston Methodist, huge hospital systems, what are the real operational reasons that ER wait times become so long?
It's because we look at it wrong. It's not that it's broken. We need to run it differently. See, the ER is just the first step in the flow. They're urgent people. They don't need to be told to get off their butt or anything like that. They care about this. But the fact of the matter is, you got to flow through to the hospital. And 1 out of 5 people are in need. And he had a modest size ER, 20 beds. You're looking at 4 admitted patients. Could really start blocking people. You can't get people through the goose. And then there's the reaction. People start to react. Nurses in the ICU start not reporting available until the shift ends. You get these little things that no one's going to go to the boss over. It's just how the culture is. Those ladies up there are hiding all the beds. Or you get into this. The lab does something. Radiology does something. Transport does something. Yet all of that friction lands in the ED. They just start deflating. And you get a preventable problem anybody could have saw if they just backed away of the urgency and got into how do we keep things moving? You go to Disney and watch how that works. They give you a little pre-entertainment. They keep you moving through it. Even though the line is long, if you kept people moving through it, you'd be better off. So you really got to find out why aren't people moving rather than what's wrong with the process. Does that make sense?
Yes. Yes. And I think people, what did they say? Like an unsolvable problem is just a question asked in the wrong way. This is that.
This is that. That's right.
Yes.
And really, one of the things, let me stop because you're about to ask about COVID. I'm about to tell a COVID story. So,
You're a little psychic. So yeah, I always kind of talk about the COVID. So, the pandemic did expose a lot of vulnerabilities in the hospital operations. I mean, so I'm sure you're going to share with us a story, but I'm also interested in how the pandemic is still impacting hospital systems today.
the pandemic didn't give us the opportunity we hoped it would give to start solving some capacity problems. Because the first thing was the finding that we didn't know what our capacity is. We shut down General Motors to build ventilators. Nobody said, where are we going to get the nurses to staff it on a 1-to-1 ratio with somebody in a ventilator on an ICU? That is not a problem that you're going to solve with the government. What about the big white boats that showed up? Nobody went to them. We don't understand the demand on the system. The smartest people in the world shut the world off because we were worried about overwhelm and capacity, and it wasn't overwhelmed. We just put so much into it that it became the issue. Pretty soon you start questioning some of the longly held beliefs about things like length of stay and velocity, and the way we were running this thing. It just exposed it. And if it didn't give us, unfortunately, the opportunity to solve it, it just exposed it. The staffing instability, the burnout, the systems that work when everything's late started to fail us. And even small disruptions started to have big consequences. The uncomfortable truth about it all is it was a great opportunity to fix. We learned to do is survive it. By surviving it, we sort of baked in a lot of cultural impact that it had. But now people are really overwhelmed, and the patients are really confrontational now, and yada yada yada. It's actually gotten a lot worse, in my opinion.
I would agree. I definitely think it has gotten a lot worse. And I think people don't even they feel so overwhelmed. They don't even they don't even feel like they have the time to stop and solve, which is unfortunate. You talked a little bit about lean manufacturing, and you have a background in lean manufacturing, and that has heavily influenced your work in hospitals. How can principles originally developed in manufacturing be applied to healthcare, which is totally different, to improve patient flow? Because we want to keep people moving from admission to discharge.
I know that hospitals masquerade as factories of care, if you want, but they really don't have the same sort of tools. For example, thinking about waste. Parts sitting in inventory is waste. It's a waste of money. It's sitting there waiting, buffering the system against shock. Where do we build inventory of ER doc care when it needs buffered? You have to get in line. You have to wait. If something goes wrong, you throw it away to a new one. Can't do that in healthcare. That is physics. behind the lead. It's getting rid of that stuff, and you can't do it. But you can adapt the thinking process. If you look at it as a complex system where the people can influence what happens next based on the context, the environment, the house is full, we're holding 4 patients, we're going to behave differently. If we're quiet, there's nobody waiting. All of these called practices or the way it's always been, we need to start questioning these things. Let me give you a story.
Okay.
I have a GI clinic as a client. They have a 3-month wait in a children's hospital for a GI colonoscopy. My kid needs that kind of care. Let me tell you something, that's serious, right? Abdominal pain on a little kid. I don't want to wait 3 months for that. And the advice, it's an emergency to go to the ER, is not helpful. Well, why does it take 3 months to get an appointment? Because they cover the entire pre-op on this scheduling call. So in the middle of the day, you get a call to schedule, and you're on the phone 90 minutes here, and 3 months from now, little Johnny can't get his procedure done if he doesn't eat popsicles for dinner the night before. So what happens next is that now they have to do 2 calls, the scheduling call and then the reminder call. And the capacity of these people to do all these calls, that there were a lot of callbacks, blah, blah, blah. In other words, the entire thing stopped because of this pre-op in the scheduling call. So our solution was to just take the appointment, schedule the appointment, and then call them right before or the day before to do pre-op. And that was the best day of their life in that clinic. They calling people who thought they were going to wait for 3 months, got an appointment the next week. Everything was wonderful. That was lean thinking. Anyway.
Yeah. And it's huge, right? And not only is it for the patient, I mean, not even for, I'll say, not even, it's not just for the system, right? But it's like, if you look at individual patients and how that impacts an individual life, an individual family, I mean, it's amazing.
I completely agree. And I had one CEO tell me, this is the most unexpected result I could have imagined from the people I didn't expect it from. It actually opened the man's eyes to the frontline staff really knows what's going on here. And despite bazillion dollars we spent on technology, the word on the street is the word that needs to be shared and exposed to the rest of the organization. You were talking about people putting freestanding centers in the community because they couldn't get an appointment. And I mean, you're talking about a huge impact on a crazy idea. Let's just schedule it. And we'll worry about the rest later.
Yeah, most definitely. So I want to shift a little bit to AI. It's a huge topic in healthcare. From your perspective, how can artificial intelligence help manage the flow of patients through the hospital, from admission to bed assignment to discharge? And even what happens after patients leave the hospital, because, in that care coordination and when it goes wrong, we know that there's going to be a bounce back, right? We're going to have more cost and, then more patients coming into the hospital. So how can AI help us here?
AI's potential is that it can look faster than room time. It can look around a corner. It can get information from disparate or disconnected systems. So, as an example, what you do at triage that you're likely to admit the person that just walked out of triage short of breath. That would give bed control a real head start, a couple hours, because especially if you're kind of busy ER, you could have just given bed control 4 hours to find them. It's that kind of thing that AI is going to help. It's going to be able to grab up information poorly formatted, unstructured, not in the record, right? The word on the street. Somebody just triage our fifth person is likely to be admitted. And there's no rooms in the ICU. Whatever you're going to do about that at 8:00 at night, and people are starting to get really antsy, what do it at 4:00 in the afternoon? What if you could call the intensivist and say, listen, we need these beds. You got somebody worse off holding in the ER. If you had a 4-hour head start on that, what would happen? I can tell you what would happen in Atlanta. They went from 4 days of diversion to 0 in 5 days. By Friday, they broke their string. Ambulance diversion, 4 days to 2 days. In 5 days. Just by giving people a heads. That's the kind of potential we could have here with AI. AI, it can get information from anywhere. I think the money we're spending on pilots and tests are cool tech people who are solving problems that people don't have. I watch Alexa go into a patient room. It becomes the biggest problem in the room. Alexa isn't listening to the patient. I mean, no, I got to tell Alexa 6 times to change the channels. It's just, why are we, then you say, this failed because the nurse is busier now. Because now the nurse gets to debug Alexa. She's not that good at it. If it needs a reminder or a timer, Alexa is useless for me. So,
Yeah, I agree. So I mentioned, and again in the intro, that you have been known for helping hospital teams achieve significant improvement in days instead of months. Everybody wants things fast, fast, fast. Do you think change in healthcare gains more momentum when it happens fast? And if so, why?
I would say that people like to win, or that they like to go fast. It's just that going fast and you're winning is sort of the recipe there, the combination. I find that if you can get the frontline staff, not the consultant, not the process improvement person that's been assigned to the Six Sigma Black Belt. If you get people in a room, listen, we have a problem. How do we fix it? I'll give you another one from Children's Hospital. They have aspirin they put in water for a syringe to put into the kennel. Aspirin. That aspirin goes, according to the pharmacy, in 15 minutes. Pharmacy makes an event. You have 15 minutes to get up to. So one nurse says, why are we doing this? why are we waiting, spoiling these doses? Not to mention the fact that we have to redo them all. When I can mix medicine myself, come on, it's aspirin, right? Set the powder here, put it in the mixes. Let us do it. And you know what? They did. Wow. 50% of calls to the pharmacy with missing meds go away. And the chaos in the pharmacy goes away. So now instead of waiting on the pharmacy can go do their work.
Yeah.
So that was a fast thing from people who could do things fast.
Yeah. I love that. And I love those stories really to bring it home. And what I get, when I talk to clinicians and other people in healthcare, is that all these protocols, algorithms, use of AI in healthcare could make it feel more rigid. And, I think a lot about soft skills in healthcare and how important they are. So in your experience, can frontline staff still feel empowered and engaged with patients, even when they have structured protocols and AI tools guiding decisions?
The one thing about structured protocols that especially frontline staff doesn't appreciate is that they think it takes away autonomy. But the opposite is true. Because protocols can reduce the cognitive load on these people. Give them a roadmap. So the key is the protocol should support thinking, but not replace it. So once it becomes so prescriptive that they feel like they got to work around it, that's when you know that you've got a bad protocol. And protocols themselves aren't bad. It's making sure that the respect is paid to the fact that these aren't machines. Patients aren't machines. They're not products. Are human beings. And they will have a reaction to what you're doing, good or bad. And so if the protocol causes a reaction that says, why the heck would we do this? Then it's not a good protocol.
Yeah. And I agree with that. And yeah, it's a really it's an interesting thing. And yeah, it's funny. I was just recently doing some background research. I'm doing a presentation on Plan, Do, Study, Act. And I feel like that's the best place, to utilize these tools.
That's right. And the AI prompt engineering people will tell you need the intent. What do you want to have happen here? And if you prompt AI to say, I want to know what I should do about this situation. My intent here is to get them to come home. That one little skill might be all the difference to making AI a useful tool in the front line or anything but.
Yeah. So my last question, I asked an iteration around this question to all my guests. You spent decades studying how hospitals actually function. If you were put in charge of fixing healthcare in the United States, what is the very first problem you would tackle and how would you start solving it?
The first thing I would do is I would make sure that it was widely known who in this hospital can move, number one. And two, why haven't they moved yet? What are we waiting on? I would have every case manager, every transporter, housekeeping, dietary, all of it. Everybody would know the outpatient radiology department, who upstairs is waiting for a bed or waiting for a chest x-ray to go home, provisional x-ray to go home before they're cleared. I would make sure everybody knew that. I would end every huddle. I would end all that communication about information that could be in a text message. And I would have that as my first thing. And then I would build an action center. That action center would have who's going to fix this, when are they going to do it, and what barriers do they need removed in order to do it. And that's it. I'd turn that on and give it 8 weeks.
How simple and fabulous is that?
It's fabulous, as I tend to be.
So if people want to find more information about who you are and what you do, how can they do that?
Well, I have just watched Johnny, Johnie, Alessandro. They'll probably have to get that off your.
Yes, we'll link it in underneath the podcast.
But that's where I'm at. My company is Amplify.com, which is a company that offers hand-holding needed. It's very simple systems folded into the way you do work.
It's amazing, and it's transformational, and I really enjoyed learning about it.
I appreciate that very much. As a manufacturing guy walking around hospitals, very often it's quite helpful if somebody with an MD says, that makes sense.
John D'Alessandro, thank you so much for joining me today. I really enjoyed the conversation.
Thank you. Enjoyed being here.
Thank you for tuning in to Taking Healthcare by Storm, Industry Insights with Quality Insights Medical Director Dr. Gene Storm. We hope that you enjoyed this episode. If you found value in what you heard, please consider subscribing to our podcast on your favorite platform. If you have any topics or guests you'd like to see on future episodes, you can reach out to us on our website. We would love to hear from you. So until next time, stay curious, stay compassionate, and keep taking healthcare by storm.